Hello and welcome to the Health Center with Ozion at Kunye. This time I'm going to present to you allergy. Yes, my name is Ozion the Expressionist, and today I'm going to treat the topic allergy. So, what is allergy? Allergy or allergic reaction is all about how our body responds to different allergens. Allergens are the certain materials in our environment, maybe the food we eat or pollens. We call them foreign proteins. When they interact with our body or with our body in any way, maybe because we are in the environment or it comes close to us, and our body reacts in a way that it does not another person do not just react to, or majority of the people do not react to such environment. So what do I mean? It means materials that become harmful to you that is normally not harmful. Yeah, a material that's supposed to be harmless that becomes harmful to certain individuals just because of their immune system or immune response. Yeah, they have high sensitivity to certain materials, and it causes them reactions or symptoms that make them very sick. Some just like we treated eczema. Eczema is equally a kind of allergic reaction because it is a immune sensitivity that you react to and causes certain kind of symptoms that manifest in the burning skin. And that's why I always tell you, do not run away from this individual because it's not contagious. Because most people perceive or think that this particular disease is contagious. No, eczema is not contagious. But here we are discussing allergy based on the other allergies that you will not even know. Let me go there. Something like in the hospital, if you come to see your doctor and your doctor is asking you questions to assess you, or your nurse, the nurse is assessing you, it is very pertinent that the doctor know what you are allergic to. If you know, you let the doctor know. Some people are allergic to rubber. By rubber, I mean latex, which helps in the production or is used in the production of rubber, different kinds of rubber. Yes, but they do not know until they react to it. Such is very dangerous because it could equally cause somebody death at a very increased effect. Some people react to peanuts. Some people react to avocado. So yes, so because of this, this is very important because this helps you to equally. Some people react to kiwi. It helps the doctor to know certain materials that are likened to this. Some react to banana. So you don't just give somebody banana because you love the person. Ask, is it good for you? Yes. And if the person is a dangerous, so because allergy is something that have been found as a very big problem, especially something you like could happen to somebody you won't even try to assist. It could be the air, in the environment. Say it's the air. No, it's not the air. It's most often the pollen. Pollens are stuff, materials that fall from tree flowers, sort of, and they infuse the atmosphere where you find yourself like yellowish, or sometimes you don't even see them. You breathe them, and it begins to cause you certain symptoms of allergy. The symptoms of allergy often run through the nose, the food pipe, GI tract, through down, and the trachea that goes to your lungs. Why? Because these things, when they come to your body or when they're in your environment where you are, your body immune system, that's the one suffering from has this allergy. Your body immune system will begin to react. There are certain processes that they transmit information. Your immunoglobulin E, certain antibody will now have to come from your plasma, your blood, and react by sending messages that come to a certain place called the mast cell. The mast cell is the allergy cell. The increased message is sent from certain medium called your mediators. The histamine and leukotrienes will now infuse the whole energy or the whole response on the mast cell. These mast cells are found in these areas that are very smooth muscles that goes down to your trachea, to your bronchi, into your lungs. That helps you to breathe. And equally through your GI going down onto your anus. So that's why when you see someone who's having allergic reaction, the person will be having certain things like runny nose, will be having sometimes difficulty breathing, shortage of breath. We'll be having inflammatory problem in the stomach, pains, reaction that will be sustained to some point. Because sometimes it depends on which kind of allergy someone is having. It does not just come and happen immediately. To some, it happens immediately. So it depends on the degree. If it is an anaphylactic reaction, which is a higher level of allergic reaction, that one kills when it happens. Bam, and it's like it happens instantly. And when it develops like that, it affects your breathing. That you will be needing a AP shot, epinephrine shot, which nobody would even mind that you're wearing clothes before it gives you if it's someone who understands what you're going through. So, but basically for allergy, which is normal allergy we are talking about, not that it is not harmful, but not as harmful, as dangerous as an anaphylactic shock. We need to equally be careful with our siblings, with our friends, whoever, to know if any one of them has allergy to something that they are eating. Because most often they don't even know that they are allergic to a certain food that they are eating. Some are allergic to milk, but when they eat it, they'll begin to have this, like even your eye responds to allergy in a certain way because you have fluid. All these areas that you have fluid in your body affects you when the allergy comes. That's why even the GI, so even your passage areas, whichever every one of them, they have slimy walls, it happens to them. And what actually causes this? When the response in the mast cell comes up, it now brings this whole reaction, a responsive reaction of the immune onto those muscles and makes those muscles, the arterial of those muscles, to dilate. On dilating those arterial, it causes what you call vascular permeability, which results in contraction. And that contraction is what causes, for instance, in the bronchi, it causes you bronchospasm. The bronchospasm is just exactly the same symptom that is called asthma if it is sustained. So asthma is just about the inflammation of the bronchiole that causes it, makes it impossible or make you struggle to breathe. So when those place is inflamed, the passageway for air becomes a little tiny. That you will need something to be done to that passage or the bronchiole for you to have better breathing. And when it happens as well, the mucus develops there and it becomes to congeal at that place, called bronchospasm. So what is needed at that time is for you to take medications from your doctor. Doctor goes to assess you and help you, give you medications that will treat you of broncho, uh, called bronchodilation, because already you have constriction there. So, but if it is not the one, because of allergy, most times you don't even need a doctor in terms of the ones that have to kill you at a time, because the people having allergy have their medications around them at home. If you don't have it, most of them use what we call the antihistamine, because histamine comes up there and it reacts this way. So you need antihistamine to reduce or ameliorate this particular reaction. Antihistamine includes something like the cetirizine, the Zyrtec, and some other medications like that. Even the cromolyn could be used to help the leukotriene inhibitors. So these are a lot of things that will be used. And if you don't get this medication I said here, please meet a doctor that will let you know this, because I try to be very careful not to give you something, tell you here, and you begin to abuse these medications, especially when it's one that has supposed to be prescribed. But for this, I hope you watch this video a lot of times to understand it, showing that you pay attention to what we say. But I love you, and that's why I'm sharing this without any charge, that you and I will remain healthy. Because Kunye has come to help you stay healthy, because health is wealth. And as I always say, knowledge is power. How do you feel watching this video? Let me hear you from the comment section. Every other thing that happens to someone who is having allergy, questions and other interactions, let's finish it up at the comment section. I love you, and I want to see you next time in our next video. Let's discuss again. This is Ozion the Expressionist, your regular host and favorite on this favorite program of health on the internet, the Health Center with Ozion at Kunia. Thank you very much for being here in this program, and see you next time.